Namaste. My name is Chandra-Mouli. After 30 years of work with the World Health Organization, I retired in August last year, and I continue to work on adolescent sexual and reproductive health and rights on my time and on my terms, making whatever contribution I can. In this presentation, I'm going to speak to you about taking stock of where the world is with adolescent health in the 30 years since the groundbreaking International Conference on Population and Development, and looking ahead to where we want it to be in 2050. The International Conference on Population and Development, the ICPD, was a groundbreaking conference that took place in Cairo in 1994. There were many firsts with the ICPD that I won't go into here. The one issue that is pertinent to this presentation is that it placed adolescents and adolescent sexual and reproductive health and rights on the global agenda for the very first time. Its long-standing effects have been important, in fact, transformational. So the first of my two questions that I want to pose and respond to today is, what is the health situation of adolescents in the world today, 30 years since the ICPD? And the answer to that is very clear. Tangible progress has been made in some areas of adolescent sexual and reproductive health and rights, but not in all areas. Tangible progress, uneven progress, slow progress, but tangible progress. Having said that, there's a huge unfinished agenda. What does that actually mean? Compared to their peers of 10 years ago or 15 years ago, adolescents in the world today are much less likely to be married by the age of 18, much less likely to be mothers by the age of 18, much less likely to experience female genital mutilation, much less likely to get HIV infection, and finally, much less likely to die of HIV-related causes once they are infected with HIV. These are important issues, and these areas of progress have occurred even in low and middle income countries and even in the poorest parts of the world. For example, it used to be said that we will never be able to prevent HIV in sub-Saharan Africa till we reduce poverty. That's not true. While there is still enormous amount of poverty and civil strife and social unrest and climate crises, HIV infections and HIV-related deaths have declined. Adolescents today are much more likely to obtain a number of services: contraceptive information and services, maternal health services, HIV testing and counseling services, human papilloma virus vaccine to prevent cervical cancer. So progress in all these areas. But of course, in each of these areas, there's much more work that still needs to be done. Progress has been uneven between countries and within countries and even within communities. From the glass half full, let's now look at the glass half empty. There's been very little or no progress in some areas of adolescent sexual and reproductive health and rights, and there's been virtually no progress in any other area of adolescent health outside of adolescent sexual and reproductive health. Girls today are much as likely as their peers 10 years ago to experience intimate partner violence or sexual violence. Girls and boys are just as likely to experience sexually transmitted infections other than HIV. Outside the sexual and reproductive health area, there's been little progress in nutrition, in mental health, in substance use, and this is a huge issue that we need to discuss today. Why has this happened and what are the implications of this? This slide lays out data on a number of areas outside of sexual and reproductive health. As you can see, in relation to depression and anxiety, in relation to loneliness, in relation to violence and injuries, in relation to obesity and overweight, and in relation to iron deficiency, anemia, virtually no progress over the last 30 years. Moving to a just published WHO report, Global Health Estimates. As you can see, there's been a decline in mortality in adolescents in both 10 to 14 and 15 to 19 age groups in both males and females. And finally, in terms of YLD, years of healthy life lost due to disability, as you can see from this slide, the graphs are almost entirely horizontal, no progress. So, to sum up this segment of my presentation, in the area of adolescent health, there has been impressive progress in some areas of adolescent sexual and reproductive health and rights, no progress in some other areas of adolescent sexual and reproductive health and rights, and virtually no progress in any other area. And that's an important issue that I want to discuss in the second part of my presentation. So, what are the implications of this? I will present 5 points from a paper that we published in 2020, which speaks to what progress has been made on adolescent sexual and reproductive health and rights, what contributed to this progress, and what are the implications of this for the future. This paper is just as relevant today as it was when it was published. 5 points. Firstly, in the 30 years since the ICPD, the world has made enormous progress in a number of areas of adolescent sexual and reproductive health and rights, and this is true even in low and middle income countries. The progress that has been made has been limited and uneven, but it has been made. Having said that, there's still an unfinished agenda in these areas and in other areas. Point number 2, the progress has been made because of investment and action in adolescent sexual and reproductive health and rights from the global to the local level. We often say we need more funds, we need more funds. The reality is that we have more funds today in adolescent sexual and reproductive health and rights than ever before. It's true that these funds are in some areas and not in others. It's also true that more funds are needed. But in areas such as HIV prevention, child marriage prevention, HPV vaccine provision, reducing unintended pregnancy, there are funds, much more funds than they were available. The challenge is to use these funds and to demonstrate success and to extend the areas of work into other areas. The third point is that the world must consolidate and expand progress on adolescent sexual and reproductive health and rights. We have a clear sense of why we need to work in this area. We have a clearer sense of what we need to do. The challenge now is how. How to deliver proven interventions at scale with quality and equity in different contexts, different social, cultural, and economic contexts. Fourthly, the world must expand. Clearly, the world must expand from a focus on adolescent sexual and reproductive health and rights alone to other areas. Ideally, we want to meet the needs and fulfill the rights of all adolescents in all the areas, in education, in employment, in sexual and reproductive health, and mental health, and substance abuse, in nutrition and violence and injuries. But that's a pipe dream. That's just not possible. So we have to move progressively, but strategically, only biting what we can chew and consolidating the gains while expanding the areas of work. Expanding too quickly will dilute our focus and achieve very little. Finally, there are huge areas that we need to be aware of and engage in: conflict and displacement, climate change, urbanization, conflict and tensions in these huge, amorphous and anonymous urban areas. But these are issues that don't just affect adolescent health, they affect health across the life course, and they affect other areas of work. Those of us working in adolescent health need to engage in these issues, press for a seat at the table to make sure that adolescent health is not neglected or sidelined or adversely affected. But this is clearly not something that we can do alone. We can't take this on alone, and small scale piecemeal approaches are of really very little value. To conclude, 30 years ago, the ICPD taught us that how you name and frame an issue affects the way it is addressed. If you name and frame an issue as a population crisis, as the world is exploding with people, it calls for forceful actions like forcible sterilization in India and the one-child policy in China. On the other hand, when you frame this as a rights issue, as a development issue, it puts the paradigm on its head and says, let's work to develop families and communities and enable them and empower them to make reproductive choices that are good for the family, for the community, and society. Similarly, today, we have the data and the evidence to name and frame adolescent health. Firstly, we have shown that success is possible in adolescent sexual and reproductive health and rights. And that is true even in the most poor countries, even in the context of difficulties, financial difficulties, and conservative contexts. Secondly, this is because of the combined efforts from the global to the local levels. Thirdly, the improvement provides confidence and a springboard for more to be done in the adolescent sexual and reproductive health and rights field and in other areas. And that is my hope for 2050, that we can build on our momentum, build on our learning, and stride forward with confidence. Thank you and namaste.